Okay, this is all fascinating. Can you share a little bit about how the Ayurvedic elements in sweet relief work?
Yeah, I'm going to speak in more broad strokes because if somebody wants to look at the granular details, it's all in this very comprehensive chart. But one thing I want to highlight here is that even when you focus on all of the different constituents in the chart, we have to zoom out and think about how the formulation itself is supporting itself. Because certain, you know, there's always a hack in Ayurveda, meaning if something is too hot, you bring something in to cool it down so it's not too hot. If something's too heavy, you lighten it up. And again, certain types of energy patterns tend to be more imbalanced in certain directions. So we need to have more of that. So it's not like everything is in perfect dynamic balance, but it's in perfect dynamic balance for what we're trying to do. And again, there's this idea of synergy that certain herbs open certain channels. Certain herbs have an affinity for a tissue type or deliver the medicines to the channel of the mind, for example, or the nervous system. So all of that's in the chart, but those are, again, broad strokes. One thing I want to say in particular is that both products do focus primarily on balancing vata dosha because vata dosha is the first to go out of balance for like 99% of people. It's the cause of 80% of disease, imbalanced vata dosha. And it's also a rampant imbalance in our society. Everybody is extremely vata overwhelmed. It's like systemically a massive issue. So even people with very little vata in their prakriti or in their constitution, everybody has really high vata essentially. And a lot of that is, again, societal. But again, focusing on the fact that vata dosha is the primary driver of illness, it is the main driver in pain and in mental imbalance, almost always. Every constitutional type can have their own type of mental imbalance, but anytime that there's pain or anxiety, vata dosha is 100% involved in that in some way. And so all of the formulations, although they are applicable to all constitutional types, balance vata dosha, especially in those tissue types that I was talking about. So for sweet relief, again, since we're targeting the areas of pain, I focus it mainly on Asthi and Mamsadhatu. Again, those are the musculoskeletal system, essentially. And then Majjadhatu, which is the nerves, because without nerves, we don't feel pain. So there has to be a focus on the nervous system if we're working with pain, and again, also on vata dosha in those tissue types. They're all doing slightly different things again, but they're all working on that level. And then having the synergy. The other thing is that in sweet relief with prana, tejas, and ojas, the sweet relief focuses a little bit more than calm and uplifted on prana and tejas. Prana is thought of as cellular intelligence, cellular consciousness, and tejas is cellular metabolism. So, and tejas is also heat at the cellular level, which is why it's metabolism. And so there has to be, when there's pain, there's an imbalance of signaling with prana and tejas in particular. So in order to kind of adjust the pain signals, we have to work on that subtle level as well as on those tissue types. And again, always focusing on the marmani that relate to the mind or the channel of the mind, because although the nervous system is definitely impacted by pain, so is the mind. And so that's the mind body component. And again, I have to just keep highlighting that in Ayurveda, the brain and the mind are separate. The brain is part of the mind, but it is not the only part of the mind. So we focus definitely in on that cellular, more energetic level as well.
Okay, just one quick follow-up question. How would you describe what exactly vata dosha is?
Vata dosha is, I mean, in essence, it's the element or the gunas related to air and ether. So it's dry, it's light, it's mobile. It's the only mobile dosha. It's the only dosha that can move because it regulates nervous system impulses. It regulates respiration. It regulates the nervous system. It regulates anywhere that there's space in the body, hence the lungs, the bones, because bones are porous and have holes in space. The pelvic cavity is governed by vata dosha because it's essentially a cavity, a bowl, a space. And so again, the gunas, you can just even look up online, but it's light, it's dry, it's rough, it's mobile, it's cold. And all of those things dry up the nervous system and cause things like anxiety, cause things like aging, cause things like pain, cause things like constipation or headaches or many, it depends on where vata is imbalanced, like what types of symptoms it will cause. And certain people, with vata dosha might be a little bit more light or might be a little bit more dry. No two vata dosha predominant people are going to be the same. It depends on their gunas. And again, where are those gunas imbalanced? But for vata dosha and people with high vata dosha, which, as I've said, is pretty much every American and every person in the Western world has high vata dosha, the main place that it shows up first is in the channel of the mind. And it always goes first through the blood and plasma. So again, we're focusing our constituents on balancing that. But eventually it kind of lodges itself into the nervous system, and it has an affinity for the nervous system because vata dosha governs the movements of the nervous system through prana. Again, that cellular intelligence. So it's basically an amalgam of elements or gunas, depending on how you look at it, but air and space are the big keynotes.
Okay, so I'm wondering why, and I think you alluded to it, but just want to ask in case there's anything else you wanted to add to it, why it is that's causing the majority of diseases.
Mainly because of its mobility. It
Okay.
can go out of, and it's also a part of mobility is lack of stability. So there's mobile and stable in those 10 pairs of qualities. And again, vata dosha is the only mobile dosha. So it's the mover and the shaker. It can move from one place to the other. It's less stable because it's very light. So it just gets out of balance much more easily. It's also considered, it's just more sensitive because it's more subtle and it's more movement oriented. It is more likely to go out of balance for pretty much for everybody. Again, because pitta can move in that it can spread like inflammation or like a rash, but it doesn't move rapidly from one place to the other. Vata dosha is the only dosha that can do that. Kapha is stagnant. It's slow. It's steady. It can grow. It can form things like tumors or grow other growths or, obesity, things like that, but it's not going to spread without vata dosha. So it's just inherently the least stable. And also because it governs the nervous system and the breath, the autonomic nervous system, all of these hormonal systems, because it's the master regulator sort of the body through the nervous system, it's affected in almost every disease process, especially more advanced disease processes like metastatic cancer. All the doshas are always going to be involved in some of those deeper pathologies.